This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
But I'm going to talk to you a little bit about our program. It's categorical, so it's all 4 years built into one program. You don't have to move. You don't have to worry about anything like that. So it's located here in Tampa, Florida. We currently have 3 residents per year, so it's a very small program, but we're increasing to 4 per year. But the smallness of our program is actually our strength. We were the first PM&R program in Florida. There's lots of diverse fellowship opportunities available. And as far as while you're in training, the opportunities that are available, the attendings are there for you. And it's literally one-on-one exposure. Clay can attest to that. You work with an attending one-on-one. So our leadership of our program is Dr. Marissa McCarthy, who is absolutely awesome. She went to U of M. She did her intern year at St. Vincent's, and then she went to Baylor for PM&R. She's board certified in PM&R and also TBI. She's been an AB PM&R oral board examiner, brain injury board question writer. She's absolutely incredible and amazing, and anybody in our program can attest to that. She's a boss, like incredible. Sharina is our program coordinator, and Sharina is awesome. She handles everything. You can text her or email her almost at any time of night, and she'll take care of it. I'm like, Sharina, do you ever sleep? Apparently not. So our clinical sites are the James A. Haley VA Hospital, where you'll spend a majority of your time, your intern, and most of your second year. And then we also rotate at Tampa General Hospital, Tampa General Rehabilitation Hospital, Moffitt Cancer Center, and then we do some educational training at our CAMELS Center. I know it's appropriately named Center for Advanced Medical Learning and Simulation. So our PGY 1 year is our intern year. You spend all of that at James A. Haley VA Hospital or at their outpatient clinics that are corresponding with that. We recently worked to get our 4 months of internal medicine wards down to 3.5. So Dan, you're welcome as an intern. It's a little easier for you. Our other rotations than our 3.5 months of internal medicine wards, we do orthopedics, neurology, infectious disease, rheumatology, emergency medicine, family medicine. Then we spend time on the SCIB vent unit, which is a special unit where you learn how to manage patients with vents, trach care. Most of these are quadriplegic patients or patients with ALS. And you work with a very awesome attending there, Dr. Alvarado, who's absolutely amazing and willing to teach anything. And then in the last month of your intern year, we set aside a month to say, come to our Intro to PM&R program, where we spend an entire month and you rotate through each of the major services, gen rehab, TBI, and spinal cord injury, so that you learn how to take over that service as a second year. We give you an intro and you're ready to go in second year, because second year, you spend 6 months, well, actually about 9 months on spinal cord injury, TBI, polytrauma, and gen rehab. It's divided up because we also get an MSK rotation doing ultrasound guided injections, an EMG nerve conduction study rotation. You also spend time at Moffitt Cancer Center on the supportive medicine or palliative medicine service, which you will get to work with some of the most amazing, compassionate, heartfelt people that you'll ever meet there. Third year, we spend a lot of time at Tampa General Hospital doing consults, inpatient care, pediatric consults, and working at outpatient clinics. We spend a lot more time at Moffitt Cancer Center. We do have a neurosurgery rotation where a lot of us, especially me, I focused on learning how to do kyphoplasties. And then we also have 2 months of interventional pain at Moffitt Cancer Center with two amazing attendings there who are absolutely incredible. And you really get one-on-one time with them. And then we come back to James A. Haley VA for ultrasound guided injections, electromyography, nerve conduction, TBI, and we do consults there. And then we also have a private pain medicine service we work with, which is Florida Pain Medicine. On our fourth year, we go back to Tampa General Hospital for consults, pediatrics, outpatient clinics. We're James A. Haley VA for gen rehab consults, amputee clinics, P&O rotation, Moffitt Cancer Center again for interventional pain, and Florida Pain Medicine for interventional pain. So we have a very diverse array of exposures throughout the years. Now, James A. Haley VA Hospital is the only or one of 5 facilities in the country that is a designated VA traumatic brain injury and polytrauma rehab center for veterans and active duty. So we get a lot of referrals, and our polytrauma floor stays pretty full. Gen rehab, we deal with patients who are not just recent amputees, but also gait trainers who are also on their like first or preliminary limb or second set of limb. A lot of orthopedic joint replacements, a lot of lumbar spinal surgeries, LAMIs. We see strokes now more on the polytrauma unit. Cardiac cases, we've kind of cut them back because they're very difficult to manage, but we still work with them at Tampa General Hospital, and we still do our COVID recovery unit. Our spinal cord injury has 2 30-bed inpatient units that are really for long-term care. And then we have our 10-bed ventilator unit that you get in your intern year with Dr. Alvarado, and another 30-bed long-term care unit where patients are basically residents. But it is a model system for spinal cord injury within the United States and within the VA itself. We're also an amputee center of excellence. People come to us from miles around. A lot of the cool facilities we have, you see our climbing wall. We have an aquatic treadmill, full aquatic center. We do a lot of adaptive sports, patients for wheelchair rugby, wheelchair football. We do virtual reality with drivers training, virtual reality for rehabilitation, and a lot of vestibular rehab for patients with any type of vestibular balance issues, whether it just be some like BPPV or something more complex. And then this is what our facility looks like. The picture on the left is what we call our Main Street view. That's from the second floor breezeway, but you can see we have PT and OT centers and places for patients and the staff to just congregate and spend time together. There's also our TheraStride treadmill, which is really used for a lot of patients with any type of gait dysfunction. We also have tons of equipment, multiple TheraStrides where patients can actually like watch themselves, not just on a virtual reality screen, but also in a mirror using old-fashioned tech to monitor themselves. Now, Tampa General Hospital is another place where we spend a lot of time. Tampa General Hospital is a maze. It's 1,040 beds, so it is a huge hospital. It's a level 1 trauma hospital, the number 3 hospital in Florida, one of the top 100 in the US. It's one of 5 burn centers in Florida and one of 2 pediatric burn centers. A lot of the consults that I've seen there have been liver, renal, cardiac, and pulmonary. And then we bring them over to our Tampa General Rehab Hospital. But we also do 2 months on our pediatric inpatient rehab unit there, which is absolutely incredible with Dr. Paul Kornberg, who is amazing. And then we do adult inpatient rehab consults and placements from there. We usually take our patients from there to TGH and Kindred Inpatient Rehabilitation Hospital. This is a new facility that was built just a few years ago, has pretty much everything we need. We treat stroke, brain injury, trauma, spinal cord injury, amputation. I've had extensive burn patients, vent patients, neurological conditions. I saw GBS. It's absolutely amazing the diversity of experiences you get there. Moffitt Cancer Center is another of our great rotations. It is in the top 10 on the US News and World Report for the best cancer hospitals. It's has probably more than 206 beds. We do neurosurgery there, palliative care, supportive care medicine service, and interventional pain there. The Camel Center is a new state-of-the-art freestanding center built for USF, which we do cadaver simulations, we do virtual reality simulations, and we have lots of other cadaver labs for ultrasound-guided injections with one-on-one guidance for our faculty. We have extensive musculoskeletal experience, spending about 4 months on conservative orthopedic management with Dr. Urbisi, doing not just diagnostic ultrasounds, but tons of ultrasound guided injections. I have probably around 800 in my case logs already of corticosteroids, hyaluronic acid supplementation, platelet rich plasma, peripheral nerve blocks, trigger points, and shockwave therapy. Other important details you need to know, PGY1, you just have in-house long call while in internal medicine every 5 days, where you basically take admissions until 7 p.m. or 8 or 9 p.m. That changed this year, so I'll let Dan answer that question when we get to it. As a PGY2, you have about 6 or 7 call days a month. There's usually 1 weekend a month and 3 to 4 weekdays. As a PGY3, that drops to 3 to 4 call days per month. So there's usually 1 weekend every 3 months and 3 to 4 weekdays, maybe every few months. And as a PGY4, which I am, I do 1 weekday call per month. Weekday call is from home. I'm here in my house from 4:30 to 8 a.m. I have my pager and I answer. Our lectures are every week on Thursday afternoons from 12:15 to about 4 p.m. We have lecturers come and provide a variety of lectures on whatever we need, even cadaver ultrasound guided injections at the Camels Lab. We have a journal club that presents monthly, and we have an extensive MSK lecture series. Like I said, our ratio with our attendings is 1-to-1, and all of your staff, you really get to know everybody. I know the nurses, I call them all by their first names, and I ask them to call me by my first name. We're like friends, but we work together. Some of the fellowships available at USF include interventional pain, SCI, TBI, and amputee. Where do our residents go? Most recently, 2 went into interventional pain, and 1 is now an attending at the VA and polytrauma rehab. So you can see our record from the past couple of years on here. Our salary and benefits have recently changed. So we increase our stipend about 3 to 4% per year. It's very nice, especially the health insurance. You get free care if you go to a USF or TGH center. We have retirement plan built in. We give reimbursement for USF Step 3 and Comlex. Life in Tampa is amazing. We have the Dolly Museum, the Strass Center. There's the Tampa Bay Bucks, who are champs, the Tampa Bay Lightning, the Rays, the Yankees have their training camps here. St. Pete, Clearwater, and Siesta Key beaches, some of the world's best beaches are here. Disney World is less than an hour and a half away. Busch Gardens is here. Gasparilla is an awesome pirate-themed, basically debaucherous event that occurs once yearly. South Tampa and North Tampa have different areas. Like I live in North Tampa. This is kind of like married, quiet suburbia, whereas South Tampa is more for singles. There's tons of stuff to do. Patient caps, you know these rules. Our board pass rate is 100%. During call, we cover about 80 patients. During weekdays, 60 to 80, and on the weekends, about 80 to 100. However, it's really quite easy to do. Do the residents teach and conduct didactics? Absolutely. We do all this. We teach. I prepare board review, journal clubs. I've made 6 teaching PowerPoints. We also teach our rotating medical students. Do we meet the required number of procedures? Absolutely. We exceed them by far. We have the standard same days of vacation, sick days, and conference personal days that everybody has. You can start moonlighting in your second year. We have a board review course that's paid for by our program. And we love our dogs. Almost everybody has a dog, but we don't discriminate. Everybody can have their furry canine friend or even kids. Multiple residents have kids. So our website is located here. You can email me with any questions. There's my email, and you can follow us up on Instagram. Do we have any questions?
Dr. Mosley.
Yes, ma'am. Please call me Will.
Hi, Will. My name is Gaganjot. I'm from Canada.
Hi.
And I was wondering, are we friendly to non-US IMGs at the program?
Absolutely. We can provide J1 visas as needed. I myself am a US IMG, International Medical Grad. So we accept anybody. Arrangements for the visas will be taken care of by Sharina, though, our awesome program director, and she can lean you a little more on that.
Amazing. Thank you so much.
Yes, ma'am. Anybody else have any questions?
Sorry,
See
perfect. I'm sorry, perfect timing. You have about 5 minutes for questions. Excellent. Thank you.
Awesome. Yeah, no problem. Tried to
See.
get through everything.
I see somebody in
Really?
the comments said, is there a hard step two cutoff score?
Generally, no. We want you to pass on your first try. But when we do our searches in the past, we do not have filters where we set a cutoff score. We look at an applicant as a whole. As a matter of fact, when we went through and picked each year's, we generally read almost every single person's personal statement, curriculum vitae, everything that they have to say. I know that my year when I went through it, I read through like 300 different applications and I looked at the whole picture.
And then I'll kind of touch on, I see Miriam's question about just kind of expanding on the culture of our program. So our two program directors, they're co-directors, it's Dr. McCarthy and then Dr. Stanley as well. They are like the two absolute best people that could ever be in charge of a program. Like they're young, they're lively, they like really encourage all of us to be ourselves, be comfortable. So they kind of set the stage. And then as far as like all of us getting together, I mean, we're in the resident room. It's literally like a family in there. I'm sure every program is probably going to say that, but it is like everybody's super comfortable. Everybody's joking around, laughing. We're very professional in the professional setting. But when we're all together, I mean, it really is a lot of fun. All of us are very different. You know, some people are single and some people go out in the nightlife. Some people are more like stay at home. Some people are married. Some people have kids. But it's a good little melting pot of personalities because you get to know everybody really intimately, especially being three people a year. We're going to expand to four people, hopefully in the next couple of years, not this year, but we're hoping to expand that soon. Also, one thing that I did want to mention that wasn't on the PowerPoint, we're in the finalizing stages of partnering with American College of Lifestyle Medicine as well. Um, this hasn't been finalized, so it's not 100% yet, but it's about 95%. So we assume that that'll be up and running by the end of the year. Basically, it's not a huge overhaul or anything, but they'll be partnering with our medical or with our residency program. PM&R is very lifestyle heavy in the first place, so we'll have no problem getting our patient encounters for what that requires. Not that much extra work. You do get to learn a little bit about that, and then we'll also be able to sit for that board exam. So we'll have the opportunity to be dual board certified by the time we finish residency, which is pretty cool.
Awesome. So I saw a question, is moonlighting in-house? No, not until you graduate. Most of the moonlighting that I do, I work for the disability clinic. I do disability exams for the Social Security Administration, and then I work for one of the local practices here, rehabilitation and electrodiagnostics. Most of the stuff that you want to do for moonlighting is outside of our program because if you can take on extra stuff inside the program, they would be like, hey, you need to work more hours officially in the program. So yeah, you want to look for things outside of there.
And there's some good opportunities to do so. Like people before us and even before like Will, his year, they kind of paved the way. They reached out on their own, they found some other opportunities. And those in a way kind of do get passed down from year to year. So by the time that you come in, there's at least 4 or 5 people who have moonlighted with different companies and are able to kind of give you their 2 cents on which one to go with.
Dan, do you have any feedback or, anything about the intern year that would shed some light and take away the fear of intern year? I know you all are terrified for it, so.
Yeah, absolutely. I would say, first of all, intern year is like less of a transition than you really think. Personally, I think our intern year at USF is great because you have enough rotations where you're going to be worked hard on internal medicine. I think that's pretty much across the board. But it's great experience. And it's only now 3.5 months of our total experience. And kind of like what Dr. Mosley was talking about, our SCI ventilator unit kind of like substitutes for like an ICU rotation because you're taking care of people on ventilators who have trachs and so on and so forth. But it's like PM&R specific. These are spinal cord injury patients. So I think that's awesome. And outside of that, we have so many outpatient rotations or like inpatient consultant rotations in our intern year that you actually get weekends off. So I think the lifestyle even in intern year is great, but the experience is all still there. And you're very involved with the program. Even now I'm playing fantasy football and I'm not winning any games yet, but it's a great bonding experience. And yeah, can't speak enough to how awesome the program culture is, even in your intern year. So.